So hello everyone, welcome back with the session, and today we are going to discuss the important session, and this topic is human skeletal system. So in this session, yes, we'll be discussing all those questions which are asked in the examination, and the questions are like in the appendicular system, how many bones are there in the axial part, how many bones are there, how many bones are present in the head. So we are going to discuss the types of joints, and also we'll be discussing the whole part of the skeletal system along with the images. So first of all, I'll request you all to please like this video and subscribe our channel so that you will not miss these topics. And also, Tuesday, Wednesday and Thursday are allocated for the theory section, and Friday, that is tomorrow, we are going to discuss the questions which were asked previously and the most expected questions from these important parts. So let's start with the session. So first of all, if I talk about this human skeletal system, guys, what do you think? What is it? So from the name itself, it is clear we are talking about the bones. So how many bones are there in our body? So the total number of bones which are present in our body are 206, and obviously in the case of kids, they are more than 300. So it's 300 plus in the case of kids, and yes, for us, they are 206. Okay, proceeding further. So here guys, if I talk about these 206 bones one by one, let's understand about it. So see, this is our skeletal system, right? Now in this skeletal part, you will find that it's divided into two sections. One is axial and another one is appendicular. So let's have a look. See, here there are total 206 bones. That is, this skeletal system consists of a framework of bones which is 206 and few cartilages. Bones are very hard due to the calcium salts, and always remember, these bones are made up of what? So you need to remember this. The bones are actually made up of calcium and phosphorus. So our bones are actually made up of calcium and phosphorus. That's the first important point. Proceeding further, cartilage has slightly pliable matrix due to chondroitin salts. Now, guys, chondroitin salts, this matrix part, are these asked in the examination? So yes, I have kept all those statements which are relevant for examination, so do not miss any single point. Proceeding further, so as discussed, the skeletal system is divided into two different sections. One is axial, which consists of 80 bones, and another one is appendicular, that consists of 126 bones. So in the axial skeletal, you can link it with the straight portion of our body, our head, the face, hyoid, sternum, ribs, and the vertebral column. They all make 80 bones. What about appendicular? So these are the bones of our forelimbs. So if I'll talk about our hands, we can talk about our legs. So they are total 120. Apart from that, we have this pectoral girdle and pelvic girdle. So total there are 126 bones which are in this appendicular part. Okay, so just have a look. So the portion, this blue colored portion is actually the appendicular part, and here this blue portion is axial skeleton. Okay. Now, first of all, let's talk about this axial skeletal in which 80 bones are there. So this is our skull portion, right? So if I talk about the skull portion, how many bones are there? So just see, this is the head part and this is the face part. So it includes skull that has 22 bones, hyoid that is 1 bone, and ear ossicle 3 cross 2, that is 6 bones are there. Now, which one is hyoid? So guys, the hyoid bone is actually linked here in our neck. So you can link it with it. Now if I talk about this ear ossicle, so these are the bones which are present in our ear. Now, I have a trick for the same. So let's say you are calling someone, right? And in order to call someone, you need a small chip-like structure. What is that? SIM card. So from the SIM card, you can link it. Yes, if I want to connect with someone, I'll just keep phone over here and I'll talk with someone, right? So the small device that is used in your mobile phone is SIM, that is SIM card, where SIM stands for S stands for steps, which is the smallest phone, I stands for incus, and M stands for melia. So one by one we'll be going in detail. So yes, there are 22 bones that are there in the skull portion. Let's have a look. See, skull has 22 bones, in which it includes the cranial bones and the facial bones. Cranial bones are 8 and 14 bones are there on a face. So what are the name of those bones? I'll show you the image also. So it includes the frontal, parietal, temporal, occipital, sphenoid and ethmoid. All the numbers are mentioned. Just have a look. That's the image. So frontal bone, parietal bone, temporal bone, sphenoid, all these parts are there in this cranial bone. If I talk about facial bone, so it has nasals to maxillae to zygomatics to lacrimals to palatines, then inferior nasals to mandible 1 and vomer 1. So the total make the 22 bones, right? That is 14 are the facial ones and 8 are in the cranium portion. Any doubts? I guess that is sorted, right? So proceeding further. Now guys, since we are talking about the skull part, so we have already discussed about the 8 bones and 14 bones, but especially here, this is the section in which we will get the clarity. This is the occipital part, parietal, frontal, temporal, sphenoid, ethmoid, nasal, zygomatic. Then we have maxilla. And if you remember this mandible, this jaw mandible is the strongest bone. So someone asks you which is the smallest bone, that is stapes, that's there in the ear, which is the hardest. So that hardest part is actually the mandible. Okay. This is vomer, where we can link it to the nose part, and that's palatine. Okay. Now guys, hyoid. This is the hyoid bone. The enlarged version is here, and that's present in our neck. So hyoid bone, that's a single bone that's present in the neck, and it's a U-shaped bone that is found at the floor of the buccal cavity. Do you know what is buccal cavity? So buccal cavity is linked with the mouth. So our mouth consists of the teeth, the tongue, and the salivary glands, which are there in 3 pairs. So they all make buccal cavity. So yes, if I'll talk about the bones in the head, so there were 22 cranial bones. If I'll cover the whole portion till here, it is total 29 here, because 22 bones in this part, one is here 23, right, and 6 in the ears, 23 and 6, that makes your 29 total bones. I guess this part is clear. Guys, if you have any question, you have any queries, you can just let me know. I am looking at the comment section, and please let me know, are you liking this session? So I'll bring the session daily, don't worry. Okay, proceeding further. So that was about 29 bones. Now guys, this is the ear section. So within the ear, you will find 3 more bones, and as discussed, whenever we call someone, we use a small device that is known as SIM. So the SIM card that you're using, that can be used as a trick. So S stands for stapes, that is the smallest bone. So 2 stapes, 2 incus and 2 malleus. So these are the earocicles, and obviously you have 2 ears, so 3 cross 2, it will give you 6 bones. Next. So if I talk about the bones of the head, so the skull actually articulates with the first vertebra, this red colored portion, that is atlas of the vertebral column, with the help of 2 occipital condyles. So yes, if someone asks you this head is connected with the vertebral column with which particular bone, so that's atlas, right? Okay, so proceeding further. Now let's talk about the vertebral column, that is the back part of our body. So this is the vertebral column, and within which this spinal cord actually lies. But we are not going to discuss about spinal cord today. We have already discussed about it in the past class, that is in the brain section. So here it is formed of 26 vertebrae, which are of 5 types. Cervical vertebrae, there are 7. Thoracic vertebrae, 12. Lumbar vertebrae, 5. Sacral vertebrae, 1 fused, and coccygeal vertebrae is 1 fused again. And this last one is actually known as the tailbone as well. Do we need to remember the numbers? Yes, you need to remember these numbers, because these numbers are actually asked in the examination. If you refer to the PYQs of SSC and railway examinations, these are actually asked. Fine. Okay, next. So this is that portion we were talking about. So this is the cervical vertebrae. This is thoracic vertebrae, lumbar, sacrum, and coccyx in the very end. Right. Okay, so now let's talk about sternum. So what is it? So sternum is actually the breastbone. So that's there on a chest, from which all the ribs are connected. So that's a single bone. It is also known as the breastbone or sternum. So that's a single bone. You can just see here. So a flat bone on the ventral midline of the thorax, where 12 pairs of ribs are connected. Just see, this was the sternum or the breastbone. Here all the ribs are connected, and ribs are basically of 3 different types: the true ribs, the false ribs, and the floating ribs. Just check. 1 to 7 they are true ribs, 8, 9 and 10 are false ribs, and then we have 11, 12 as the floating ribs. So what are they? Just have a look. So true ribs for 7 pairs, then vertebrochondral, that is false ribs, 8th, 9th and 10th pair, then floating ribs 11th and 12th pair. Okay. Now These were the bones we are talking about. So guys, here each rib has two articulation surfaces on its dorsal end, so it is known as bicephalic. True ribs are attached to the thoracic vertebrae and ventrally connected to the sternum with the help of hyaline cartilage. Acha, cartilage is also of three different types, right? It may be fibrocartilage, it may be hyaline cartilage. False ribs do not articulate directly with the sternum but join the seventh rib with the help of hyaline cartilage. Floating ribs are not connected ventrally, just check. So if I talk about these last ribs, they are not connected here, right? So they are actually floating ribs. So floating ribs are present at the extreme end. So they are not tying up with the bone again. So it seems like it's only coming out and it's not tied up again. That's all about the floating ribs. Okay. Now guys, let's talk about the bones of the limbs. So we have discussed about the 80 bones which were there in the axial part. What about appendicular? So in the appendicular system, there are total 126 bones, right? So how do we count them? So first of all, we'll start with a hand. So if I'll talk about this limb, so that's known as forelimb, because earlier, if I'll talk about the theory of evolution, who gave it? Charles Darwin actually gave us the theory of evolution, right? So if I talk about this Charles Darwin, so when he gave the theory of evolution, so according to him, we belong to the family of apes. So earlier, we looked like monkeys, right? So we used our hands and legs both to move. So if I'll just move like this will be my foreleg, and the legs which I'm using right now, that will be acting as a hind limb. So here we are talking about the forelimb, that means we are talking about the hands. So there are total 60 bones here, that is 30 on each particular arm. So that is the portion. So that is the first part, that is humerus. Obviously it will be two, one on the right arm, one on the left arm. So two humerus, two radius, two ulna. Then we have carpals, metacarpals and phalanges. So one by one, let's have a look. So they include humerus. It's talking about a single arm, so that's one. Radius single, ulna single, carpals, wrist bones, there are 8. Metacarpal, there is 5. They are the palm bones, and then we have phalanges, that is 14. So do we have any trick to remember them? Yeah, I have. So first of all, this is the humerus portion. Radius and ulna, single bones. Then metacarpal, the wrist part, 8. Then palm portion, metacarpal, 5. And then these phalanges. So for these phalanges, how you can just remember it? Let me tell you. So thank you, Amit. Thank you so much. How are you, Amit? So Amit, if I talk about my finger, so as of now, just try to connect it. See, it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. So there are total 14 bones which are present. So guys, obviously I have two hints. So Amit Pratap 8801, this gives us clarity that the total number of phalanges will be 28 if we'll talk about both the arms. So for the single section, 30 bones, and yes, since we have two arms, so total 60. Similarly, if I talk about my leg portion, so here again we'll have the same amount of bones, but the count actually varies. How? Just have a look. See, if I talk about my leg, so this is the longest bone, which is known as femur. So you must remember this. It is asked again and again, repeatedly in the examination. If I talk about femur, femur is actually the longest and heaviest bone. Please remember both the things. It's both longest as well as heaviest. Okay. Now guys, after this femur, which is the longest bone, we have a kneecap, right? So that's patella. That's a single bone. Then we have single tibia and single fibula. Then we have tarsals, metatarsal and phalanges again with the same count. So just have a look. So there are again 60 bones. So they include femur, which is the longest bone, it is 1. Then patella, we have a single kneecap, single tibia and single fibula. Tarsals, that is the ankle bones, they are 7. Metatarsals are 5. And phalanges, they are 14. So again the same count, and let me check, do we have any doubt as of now? Are understanding it perfectly? Okay, Amit, that's great. So wherever you feel like you have any question, any doubt, any queries, do not hesitate. Just treat this YouTube session as a paid batch. I've already said this. I'm always there for you all, and daily at 5 p.m. we'll meet. So tomorrow we'll be having the practice session. Do not miss that session. Okay, proceeding further. So now guys, talking about the pectoral girdle, where is it present? So this pectoral girdle is actually present on my shoulders. So if I talk about my shoulder, on this portion I have 2 bones here and 2 here. So here, just have a look. This is the clavicle or the collar bone. and this portion is known as scapula. So here we have 2 cross 2, that is 4 bones, so they have form of clavicle, that is the collarbone 2, and scapula, that is the shoulder blade, again 2. What about the hip bone? So if I talk about the hip bones, there are just 2. So in the pelvic girdle there are 2 bones. Okay, so scapula is a large triangular flat bone which is situated in the dorsal part of the thorax between the second and the seventh ribs. Scapula has a slightly elevated ridge which projects as a flat expanded process called the acromion. The clavicle articulates with this. So below the acromion is a depression which articulates with the head of the humerus to form the shoulder joint. And here we have total just 2 bones, and they are formed of two coxal bones, and each coxal bone is formed by the fusion of 3 bones, that is ilium, ischium and pubis. Fine. So that's all about this section. Now it's the time to understand about the joints. Guys, do you know that joints are also different types? One by one, I'll explain the joints now, and then in the ending, we'll just revise it, and then we'll wind up the session. Fine. So let's start with the joints now. So guys, just have a look at this image. So see, it may be non-moving joint, they may be the partially moving joints, or they may be the freely moving joints. So freely moving joints can be linked with your knee, you can link it with your elbow portion, right? So one by one, let's understand about it. So joints are the points of contact between the bones and between the bones and cartilages. Okay. So they are of 3 different types. Fibrous, which are immovable, that is they are unable to move. Then we have cartilaginous, that is slightly movable joints, and synovial, which are movable joints, and you can just link it with the fluid also, which is synovial fluid. Where is this present? Synovial fluid is present in our kneecap, if you remember, right? So in the old age, because of the issue with this particular fluid, old aged people, they feel difficult in moving because of the lack of the synovial fluid in the joints. Okay, so talking about the first part, that is your fibrous joints. So they are immovable, that is they cannot move, so you can just link it from the skull portion because they are not able to move, so they are immovable joints. Proceeding further, so the examples can be there. Stairs between the flat skull bones, the image is also given here. So that's the stairs on the skull part. Then if I talk about the cartilaginous joints, so they are slightly movable. So if I talk about my backbone, so see, I am able to bend. I am able to bend, but I can bend only up to a certain limit. So it's not like that I can I'll just keep on moving backwards and I can just touch the ground. No, that's not possible for me, right? Although some bodies are flexible, they are able to touch it, but they are very rare people, right? So yes, these cartilaginous joints are the ones which are slightly movable, where you can link it with your vertebral column. So they are slightly movable joints. Bones are joined together with the help of cartilages. Joints between the adjacent vertebrae, they are its example. What about synovial? So again, I'll repeat my same statement. So you can actually link it with the synovial fluid. So yes, all those joints where you can link it with your knee joint, you can talk about your elbow. So they are the ones on which it is free to move, right? So that's all about the synovial joints where free movement is available. So here, just check. So that's the knee part here. And here you'll find this liquid. Can you see this yellow color structure? So that's what synovial fluid is. Okay. So yes, they are the examples of movable joints. They are characterized by the presence of a fluid filled synovial cavity between the articulating surface of the 2 bones. Now, one by one, let's have an example and then we'll wind up the session. Fine. So here, just have a look. If I talk about the types of synovial joints, so the first one is ball and socket joint. So what are the examples? The shoulder joint and the hip joint are the examples of ball and socket joint. Then hinge joint, that is the knee joint, and the elbow joints are the example of hinge joint. Just have a look. So that's the example of a hinge joint. Then pivot joint, just have a look. So their necks and elbows are given. So pivot joints are the joints between the atlas and the axis, and do not get confused. Where this atlas was, if you remember, when we were discussing about the facial bones, so that was present on the neck portion, right? So yes, that's the topmost bone over there. So that's the example of pivot joint. Then gliding joint, so they are the joints between the carpals. So where are these carpals? So carpals and metacarpals, if you remember. So guys, this bone, right? So that's your gliding joint. So joints between the carpals. And if I talk about the saddle joint, so joint between the carpal and metacarpal of the thumb. So that's the saddle joint. So if you link it with this portion, that is the thumb portion, that's the joint. So they were all the joints. I guess this part is clear. So now, if you want, we can discuss the disorders also, because in the biology section, there are a lot of questions which are asked from this disorder section. So we can also link it with the human health and diseases. But yes, it would be easy to link because we have just discussed about the skeletal system. So do you want to discuss as of now? If yes, we can discuss it. Otherwise, we can wind up the session because the topic was skeletal system and all those questions which are asked from this topic, we have completed everything except two. So you need to remember two more things. Guys, number one, the total number of muscles are actually 639. The smallest muscle is stapedies. Yes, stapes is the smallest bone, but stapedies is the smallest muscle. The strongest muscle is actually your tongue, and the longest muscle or the largest muscle is sartorius. Right? Okay. Now, the second important point is bones to bones are connected by what? So, bone to bone is connected by the ligament, and bone to muscle is linked by tendon. So bone to muscle tendon and bone to bone ligament. So these are the important ones. So let's have a discussion on the disorders also. So the first disorder of this musculoskeletal system is in front of you, and this is myasthenia gravis. Now what is this? Myasthenia gravis. So here that's an autoimmune disorder. It affects the neuromuscular junction. It leads to fatigue, weakening and paralysis of the skeletal muscles. So that is myasthenia gravis. So that's the issue with the nerve cell. Second, then we have muscular dystrophy. So these are the normal biceps, but you might have seen some people have very thin biceps like this. So biceps with the muscular dystrophy, they seem to be very straight. So that is the example of muscular dystrophy. Then here, that's the progressive degeneration of the skeletal muscles. It's mostly due to the genetic disorder. Then we have tetany. So what's it? Now again, there's a deformation in the bones as you can see in the image. Here, it is rapid spasm in the muscle due to low calcium in the body fluid. And as we know, if I'll talk about the calcium ions, so our bone is made up of calcium and phosphorus. So yes, that's important too. Then proceeding further, what about arthritis? So arthritis is the issue in which there's a severe pain in the joints. So that's what arthritis is. Now there might be certain reasons for the same. So that's the inflammation of the joints. Then we have osteoporosis. Now what is osteoporosis? So that's the lesser density of the bones, or we can say softening of the bones, which is very common in the old age. So the bone density, as you can see, this is the normal bone matrix. But in the case of osteoporosis, you can just see the large gaps. This is the perfect example of osteoporosis where softening of the bones are there. Now because soft bones are there, so it can easily crack. And that's very common in the old age. If bone breaks, it is difficult to recover. That's the reason behind it. So I guess that's clear. So yes, that's an age-related disorder. It's characterized by the decreased bone mass and increased chances of fractures. Decreased level of estrogen is the most common cause. Then the next one is gout. Now what is gout? So guys, it's very common issue, especially in the winter season. We people are like, I don't want to go to washroom. I'll just control the urine. Never do that. I repeat my words, never do that, because at that time you'll feel like, okay, I'm just saving my time. But guys, slowly, the uric acid, when it gets deposited in your bones, it creates issue. So the deposition of the uric acid leads to gout, and this is again another form of arthritis where there's a pain in the joints. Okay, so what is gout? Just see here. So there's this swollen and inflamed joint. What is the reason? The deposition of the uric acid, right? So it is the inflammation of the joints due to accumulation of the uric acid crystals. So these are the uric acid crystals which are deposited here, and it also leads to the pain. So all these things were related to the disorders, and that's all from my end. And guys, now tomorrow at 5 p.m. sharp, see what we have discussed this time. We started with the heart, then we discussed brain, and today we have discussed the skeletal system. So in the tomorrow's class, it is at sharp 5. Please do not forget to join. In the next class, we'll have a discussion on the previous year papers and the most expected questions which are related with these chapters. So yes, this will continue now for every week. So on Monday, obviously we have the live test in which I'm discussing all the questions which are related with the GS section. Tuesday, Wednesday and Thursday, they are allotted for the theory section where we'll cover up the whole GS. We are starting with the science first, then we'll complete the history, geography and so on. So yes, you can just take the theory sessions on Tuesday, Wednesday, Thursday at 5, and on Friday, just like tomorrow, we'll have the practice session of these particular topics. So that's all from mine, and if you have any doubts or queries, you can just let me know in the comment section. So let me check. Mr. Amit, do you have any doubt or query? And thank you for your wonderful comments, Amit. Very happy to see them. Okay, so guys, I'm just winding up this session. I'll be waiting for you all in the comment section, and please let me know in the comment section, are you liking this session? Because it feels great and it actually motivates me to create all those slides for you people, all those animations, all those images, so that I can give you the best content that is possible, that too free of cost, right? Okay, Acha, one more thing. Guys, if you want to join any of the paid batches, you can just type Oliveboard. You will click on the first link of the Oliveboard and you can see 59% off is given by using the code SUPER. So what you can do, here we have SSC plus Railway Super Elite batch for all the Hindi medium courses and the English medium courses are available in this part. So free live classes, tests, notes for all the SSC and Railways classes, everything is present here. And for the maximum discount, you can just use the code SUPER as discussed. So that's all from my end. We'll meet tomorrow now at sharp at 5 with the questions. Thank you guys. Thank you. Bye bye guys. Take care. Jai Hind. And for the examination, all the very best.